Hi, I'm Dr. Kathryn Torok from Children's Hospital of Pittsburgh of UPMC, the Pediatric Rheumatology Division, and my special interest is pediatric scleroderma. Pediatric scleroderma comes in two different forms. One is localized scleroderma and the other one is systemic sclerosis. I'm going to talk about the two different kinds, but let's first focus on localized scleroderma. This is also known as morphia. Scleroderma means sclero, which is thickening or hardening, and derma is skin. So its thick skin is what it's well known for. There's also some discoloration and other changes of the skin. Typically these patients may take a year or two to come to our office because sometimes it looks like bruising or other skin changes, and they see dermatologists and other specialists until they come our way. And their typical age of onset is school age, so around 8 years old is the average age. But it can be as young as infancy and later in adulthood as well. There's several different kinds of localized scleroderma. I'm just going to focus on the main 3 or 4 types and just show you some photographs so you can become a little more familiar of the disease manifestations. The first type is called plaque morphia, where there's just kind of 1 or 2 single lesions and there's thickness or whiteness in the center of the lesion, and then some discoloration around the lesion or redness around the lesion when it's spreading. So this is just an example of someone have a lesion on their inner arm. Another example is a patient that had a plaque lesion on her neck, and you can see the center is kind of white, and that's actually a little bit thick. That's the sclerotic or hardening of the skin, and then around is a little bit red and a little bit discolored, a little bit brown. There's also some thinning of the skin that happens, and that's why you can see her veins a little bit more than typical. Another type of localized scleroderma is called generalized morphia. That's when you have several different plaques like those pictures I showed you, but they all kind of come together. And this is a patient's trunk. It's her abdomen, and you can see she has several different lesions, and she's Caucasian, so you can see a lot of these have a brownish discoloration, and then the skin is thin and you can see her veins a little bit as well. Another major type of localized scleroderma is called linear morphia or linear scleroderma, and this is called linear because it goes down in a line, either down the arm or down the leg or down the face, or a combination of them. This is an example of a young female patient that has linear scleroderma down her one leg. So you can see the one leg is actually smaller than the other, and it's actually shorter than the other. In this type of scleroderma, it crosses the joints, so sometimes they get what's called a joint contracture, where the joint doesn't go the full range of motion and they need physical therapy as well as medications to help the joint move. This girl also has the linear scleroderma of her leg, and you can see it's smaller, but the skin changes are not present anymore because she had some treatment. The other type of linear scleroderma, this is a girl's scalp, so she's facing down and it goes in a line down her scalp and actually goes down on her face, but for patient confidentiality I didn't want to show her face. And you can see in that line she's missing the hair because it's affecting the dermis layer of the skin, and that's where the hair grows. And the most common type of localized scleroderma is called deep morphia. This is a patient's trunk or the side of their abdomen, and this is kind of a scooped out lesion with a little bit of redness on the surface of the skin. This picture's a little more clear that it's actually a scooped out type of lesion where you're missing some of the fat and it looks like a divot in the skin. The line is actually not from the disease, that's from an incision from a biopsy, which goes on to how this is diagnosed. Usually it's a clinical diagnosis by those skin changes that I mentioned, but sometimes a biopsy is necessary to look at the skin under the microscope and make the official diagnosis. So treatment of this disease is the next topic would be, if you just have that one plaque lesion, sometimes the dermatologist will treat with topical steroids and other agents that you just rub on the skin. But when you have multiple lesions or lesions that cross the joint, as I showed you, then usually that requires what we call systemic medication, or medication that affects the whole body, meaning steroids, usually prednisone, and methotrexate. So those 2 medications are commonly used, and the children tolerate quite well overall. And this stops the disease from progressing within several months, and then starts to reverse some of those disease damage changes that you saw, such as the pigment might get a little bit lighter, the skin thickness will get softer, and those joint contractures will be less noticeable. The joints will be able to move better. In conjunction with physical therapy is quite typical for treatment. So that's kind of what I wanted to share with you about localized scleroderma. And I hold a localized scleroderma clinic two times a month, so we have a specialized clinic here. If you would like to contact me, please look at the children's website. Also, our office number is 412-692-5081. Thank you.